All right. So where did I stop? Alcoholism? Which slide? Respiratory, chronic. Oh, we haven't talked about this. Delivery. Did we talk about this? Did we talk about this slide? 12. Oh,
I
13.
can't remember.
I don't remember either. It just went so fast, huh?
Yeah,
I
yes,
think
we
we
did.
stopped at 13.
Yeah, we
Yeah,
did.
13,
we
right?
stopped right there. We didn't get to 13.
Okay, sure. Let's go from the 13 first, okay? From the beginning. All right. So, alcohol abuse is kind of withdraw and have some kind of delivery problem, okay? And for sure, it's kind of agitation and disorientation and hallucination. This three things is a very typical part. Okay, they give anxiety if they cannot, body cannot testing any alcohol, and of course they get disorientation if they don't have alcohol level in their body, and of course hallucination all the time. So this is the picture you can see by yourself. It's kind of like a syndrome, okay? And here, there's an alcohol withdrawal have a two sides, and I want to talk about it. So, the first one is this. Garnicki is a German name, so that's why I don't know really how to pronounce it. So, encephalopathy, okay, it's kind of like a brain disorder. This is acute. This is acute. And this one, Korsakoff, this is chronic. So that's why when the people tell you okay, alcohol withdrawal syndrome, and you have these two syndrome, okay, with a W, this one, and also with a Korsakoff. This is kind of like a difference. This is acute. And this is chronic. So when we didn't treat the acute very well, we'll go to the chronic, become this one. So that's why this is not difficult. Okay, you just need to remember one is acute, one is chronic. Okay, so it doesn't matter go to the acute or chronic, they both kind of like an emergency. Okay, let's go the acute one first. Okay, it's acute. So when the patient just drinking alcohol so long, and actually the body, the neural, so the brain is lack of some kind of like a vitamin, is lack of a vitamin B1, because the alcohol is kind of stop the vitamin B1 absorption and to your neural system. So that's why they lack of vitamin B1. So when we talk about vitamin B, this kind of vitamin, we talk about vitamin B6, right? When we taking some kind of like a TB medication, and the patient will have some kind of neuropathy. So it's kind of numbing and tingling. So that's why you will know. So vitamin B complex, all the vitamin B group of this vitamin, so they all related to some kind of a neural disorder. So for the alcohol, here is vitamin B1. If we don't have a vitamin B1 for them, for their brain, and it will cause some kind of brain disorder. Okay, it can cause like some kind of like a memory loss. Okay, like involved with eye movement, the involuntary. So eye will moving by not by themselves. It just not involuntary, and also double vision and lack of a muscle coordination. That means what? They kind of like unsteady gait and they will have some kind of movement and also tremor. So they don't want it, but it just happened, and disorientation. So what's the treatment for that for the acute stage? So we have to give vitamin B1. Give them back the vitamin B1. So that's why with the IV hydration, because when they're drinking the alcohol, actually it's dehydrated. They are not drinking the water. Alcohol is not water. Okay, remember this. They are not water. So that's why when you're drinking the alcohol, your body is kind of dehydrated. So also give them the anti-seizure medication because they are going to have a seizure very soon. And the anti-seizure medication, we like to give something is kind of benzodiazepine. We give it a lot. Here, Korsakoff psychosis or Korsakoff syndrome. Because we didn't treat acute very well, either way, it just happens so long and so many times, and the patient just not stopping drinking. So will become to the chronic. Okay, so that means what? The lack of vitamin B1 so long. It's been so long already. So they become like it's kind of permanent the brain damage. So for sure, here, the short-term memory loss, it becomes like a permanent. So these patients always have this kind of memory problem. You told them something, they just don't remember. They don't remember what time they eat. They don't remember when the last time they've been eating or they're taking the medication. Okay, and the disorientation, of course, and delirium, insomnia, hallucination, and also the painful extremity because it's numbing and tingling, and the food dropping and affecting the gait. So remember this. This is kind of becoming like an unsteady gait. And this is advanced, become like affecting the gait. They cannot just walk very well because the foot drop. So that's why this is kind of like an upgrade. It's all become like the chronic just become all the upgrade alcohol withdrawal syndrome. So become like a permanent. It's not reversible anymore. Even you just give the vitamin V1, it can stop the further damage, but it's not coming back so well. Alright, so this is the picture you can see by yourself. You can see the Korsakoff syndrome. For sure, here is kind of memory loss already. Alright, so the disorder for the associated with the alcohol withdrawal syndrome or alcoholism. So for sure, first thing is GI, because you've been drinking will affect to your GI immediately. So will get gastritis and also pancreatitis. So will damage to your stomach and also your pancreas. So cause the pancreas have inflammation usually is happen a lot, and also of course it will cause some kind of cancer, right? You drinking and smoking. You get a cancer very easy. And also will affect your esophageal and also your stomach, and esophageal virus will cause esophageal have lots of like a breathing disorder. GI breathing is also here. Meal absorption, that means nutrition, malnutrition. They are not eating because they just been drinking. Ascites, because the liver failure is all the water accumulate in your stomach. Hepatic, that means damage to the liver. Hepatitis, so that means the liver is getting inflammation. And cirrhosis, that means alcohol is a permanent damage, become like a hardness. Fatty liver and the liver failure and esophageal and breathing disorder, because the liver get damaged and your breathing factor is not produced by your liver anymore. So the breathing factor, we say breathing factor like a 6 or 9, 10, 11. So this breathing factor actually is produced by your liver. So this is the reason that hemophilia patient, they don't have this kind of factor because their liver is not produced this enzyme. So that's why it causes the hemophilia. That's why you need to constantly just get a blood transfusion, right? It also happened to the liver failure patient because the liver is not functioning anymore. That's why they are lack of a blood clotting factor. So that's why they have a breathing disorder. The cardio and vascular disease and also breathing problem. So hypertension and enlargement of the heart, because the heart need to working harder because the alcohol is not providing the good energy because it's not a food. High cholesterol and heart failure, potential hypertension and low glucose because you're not eating, you're just drinking. So that's a glucose, it will eventually go down. Anemia, because alcohol is kind of depressed with all your blood cell produced by your red bone marrow. So no matter what, red blood cell, white blood cell, and platelet. So it's all been like a limitation and they cannot produce. So this is the reason we decrease the liver, the clotting factor because the liver failure. And also because your bone marrow is not produce the platelet. So this is the reason, that's why for the people that drinking, they have like a breathing disorder. Very easy. Poor clotting ability. Okay, so that means what? They don't have a clotting. The bleeding is very easy. And also cause infection very easy because they've been drinking, not eating. So that's why the lack of immune system strength. All right, and the other part is the breathing, because they don't have very good immune system. That's why they cause pneumonia very easy. That's why it's immune disease. It's not because the lung have something wrong. It's because the immune get impaired first, and that's why because will become a pneumonia. And also the Euro problem. So they have like proselytitis and also UTI and urinary tract something like impetus. Okay, muscle skeleton problem, because we are limitation to the bone. The bone is not produced with all the blood cell, and also the bone is not absorb the calcium. And also another problem is because you've been drinking and you're not eating, that's why you're not intake the calcium very well. So that's why for the alcoholism patient, they get bone fracture very easy. And of course, the neural problem, right? And the neuritis, and also because like a vitamin B1, that's why it will become like a encephalopathy and also cause psychosis. And the gait change because because it's unsteady, because all the nerve cannot send in a signal to your both lower leg extremity. That's why they don't work very well. And of course, memory loss. And some video here, you can check it by yourself, okay? All right, let's talk about your nursing intervention for the patient have alcohol withdrawal symptom. So, of course, we need to prevent it's become more severe, right? And also safety management because we don't want to get injury. So, the assessment tool here is the one. So, clinical instituted withdrawal assessment. We call this CWA. Okay, for the alcohol scale. So the CWA air means AR. So C1 is come from this one. Clinical institutions withdrawal assessment. So now most of the hospital we use the C1 right now because we use it to assess the patient how much score of their possible having the alcohol. So if the score get higher, that means they have a higher rate to get a withdrawal symptom. So if the lower rate very low, like maybe like a 3 or 2, that means most likely patient doesn't will get an alcohol withdrawal symptom. So this is higher, it's worse. Okay, remember C1, if it's getting higher, it get worse. Lower is better. We want the patient going lower. Below 3, below 2 is good. That means the patient can be discharged. Vital sign monitor because the effect to the heart and also the breathing, right? So the heart rate and the blood pressure. So also temperature because it could be have like infection. Tachycardia, hypertension is the most of the first sign of a withdrawal symptom. All right, safety precaution. Unfortunately, this patient will get a seizure very easy because the lack of vitamin B1 and it's kind of impulses. So that's why no matter what, the signal cannot send to your body very well. And remember, I say something very important. The alcohol just depress with all the neurotransmitter, all your neural and the conductive. So that's why they are not active. So when all the alcohol is gone for your body, suddenly with all your neurotransmitter and with all these kind of electrical impulses, suddenly just happen. Everybody just sending a signal in one time. So that means what? Your body is not listening to your brain. Everybody, all of your organ, also your muscle, just suddenly just have a tremor. So that's why it causes a seizure. So for the seizure precaution, what should we do? Patting the Cyreal and the suction equipment on the back side. And also you maybe want to monitor the patient constantly, like every 15 to 30 minutes. And also giving some like anti-seizure medication. Environment management. So provide a calm and quiet and also dim the room. Because the problem is if the patient, the listening and also the light is too strong, it's kind of trigger their brain have a seizure activity. So that's why the quiet room, so and also dim the light, just not having lots of light and just kind of dark, is kind of reduce the agitation and the brain's activity. That's why the patient won't have a seizure that's so easy. But here is the problem. You're gonna tell me, okay, Patrick, if I want a patient to stay in the quiet room, does that mean I want to just put a patient in a very far away from the nursing station, not so loud, and that's why patient can have like a maybe more quiet environment. That's why they don't cause a seizure. Do you think that's a safe to put a patient away from the nursing station for this patient? Alcohol withdrawal syndrome.
No.
No, it's even more danger. You need to constantly to come to see this patient all the time because they get seizure very easy, right? So I understand you want to get like a more quiet environment for the patient. So the better idea is what? Some people tell me, okay, just shut the door, close the door. Can we close the door for this patient?
No.
No, why not? Because this is dangerous. You don't see the patient that's so easy. How can you know the patient is having a seizure attack, right? We cannot put a monitor inside the room unless you have a seater. You have somebody inside the room watch the patient for you, right? So usually for this kind of seizure precaution patient, we would like to open the door. Maybe not open the whole door, but at least we still open 45 degree. Remember, the door still have a 45 degree open. That's why we can see inside the patient activity. right? So that's why. So put the patient close to the nursing station and not close to the door. But how can not just provide a quiet environment for the patient? You need to tell everybody, don't talk, don't make it so loud, right? But they don't know this patient is a seizure. That's why we have a site, okay, the seizure precaution site on the door, telling everybody, okay, this patient is a seizure precaution. So that's why please keep your voice down. Okay, because the patient need to sleep, they need to heal. Hydration and nutrition, okay, patient is not eating, they just keep drinking. So for sure, they are going to have like a dehydration, also malnutrition. So that's why we need to establish it with some kind of like a nutrition process. From the beginning, patient maybe cannot eat because they kind of like a withdrawal symptom, they kind of like confused and they're being very agitated. So that's why IV hydration is very important. Just give the IV. So maybe also with some glucose, right? Maybe like a D5 IV, they have some sugar inside. And remember, because we also need to give a vitamin B1, thiamine. Okay, we have to give thiamine, vitamin B1 to the patient to prevent the patient is gonna have an encephalopathy and also what's another one? I suddenly just forgot. Oh my god. Oh, Korsakoff syndrome. Also prevent the Korsakoff syndrome. So that's why we have to give a vitamin B1. Okay. So that's why you're gonna see the patient. The IV fluid is yellow color. All right, for the medication, we don't want a patient to have a seizure, so that's why we use a benzo. So the benzo, we have a two category of medication is a superstar. I forgot this. Please highlight this. Okay, diazepam and also lorazepam. This is Ativan and also Valium. Okay, the first one is Valium, and the second one is Ativan. We use these two medication to calm the patient seizure attack. So that's why the patient won't have like the seizure and also like a tremor. It's helping the patient just calm down the seizure and also the brain activity. That's why a patient will sleep, will constantly sleep and resting for their brain. All right, and the symptom trigger medication. That means what? When you want to get a medication, please based on the CWA score. Okay, so how much is a CWA? So for example, if a doctor have an order, say, okay, the patient's CWA score if it is over 7, okay, please give Ativan because I don't want the patient have like a possible seizure attack. Okay, so follow the doctor's order. Okay, see the doctor's order. So in what of the order, what should I give? So if a patient the CWAS score just only 3, I don't think you need to give any medication. You just monitor, right? Just checking the vital sign. So please do not just provide some kind of like active and value to the patient. Why? Because it's over sedation. We don't want to over sedate the patient, okay? Because alcohol is a CNS depressant substance abuse already. And if you give a benzo, it's going to be the sedate the patient also. So the patient may not breathe. Then maybe he's not breathing anymore. So that's why be careful. And suppose the medication, okay, we can give some kind of anti-seizure medication if necessary. Usually it's necessary. An antipsychotic and also the seizure medication usually is necessary. So that's why if the doctor have an order, just remember give to patient, okay. Usually this is a IV. We give the IV because the patient in this time, acute phase, they cannot eat and drink. They've been sleeping. All right. This is a very famous alcohol withdrawal medication. You have to know this is superstar medication. Okay, NCLEX asking every year. Okay, Librium. So this is also benzodiazepam medication. But this medication is so special. We use to treat the patient if they are drinking the alcohol, have some kind of addicted to the alcohol, control the substance. But this medication, Librium, is a control medication. Is Schedule 4. Okay, it's even more higher than the Ativan and Valium. Okay, the Ativan and Valium, they are control medication. Most of benzo, they are control medication. But the different thing is because we use a Valium and Ativan so well, we know this medication better. But the Librium will only usually we use just for the patient they have alcohol addicted or withdrawal syndrome. So that means most of people they don't know how to use this medication. This is the reason this medication have lots of potential threat to the patient. It could be kill the patient, like over sedated. So that's why they put the schedule in 4 and tell all the nurses and doctors, be careful. When you want to give this medication, you need to check. You must check the patient, okay? Again, for all the benzodiazepam, they have a liver toxicity. They're going to damage your liver. So that's why be careful when you give this medication. This medication you need to give the high dose from the beginning because we need to calm the patient down. So if a patient been drinking already, they're gonna do become like a liver damage already, right? So if a patient liver is not good, so that means this medication maybe is not a good choice for the patient. So that's why you're gonna tell me, say, but Patrick, the patient been drinking like this, okay, and we need a medication to control the withdrawal symptom, right? Yes, I understand. But the problem is that we don't want to kill the patient's liver. We still want the liver have certain function, right? So that means what? If I find out the liver function is not good already, so I probably won't use this medication. We probably will use other medication, not the benzo anymore. Just remember this, okay? All right, control the substance with addictive potential. And this liver is used for the short-term management. So we don't use it for the long term. Okay. So most likely for the patient from the beginning, we want just the patient take out the withdrawal symptom, and also the patient maybe have a very strong addicted. Even in the hospital, they're hungry for the alcohol. They want the alcohol so bad. So that's why we give this medication decrease their brain desire. So that's why the brain is not keep thinking about the alcohol all the time. So that's why calm the patient down. All right. We can also use it for the patient have like anxiety, the agitated, also tremor, and prevent the delirium tremor, and also during the patient that during like a detox. So like the withdrawal for alcohol, their hunger for the alcohol. The warning precaution, okay, it will cause addictive. So that's why long-term use is never a good design. It's never a good idea. So we use it for the short term. So how short is short? How long is long? If you tell me the patient uses the Librium is over 3 months, this is long term already. So that's why below 2 to 3 months using, we still consider maybe it's short term. Over 3 months, this is long term already. So that's why usually we don't let the patient taking like over 3 months or 4 months, and also significant the liver damage and withdrawal. If we stop using this medication, the doctor orders this medication, that the patient use it, and that means what? They cannot stop immediately. Okay, will cause the severe withdrawal symptom again. So that means what? The patient that have a hunger for the alcohol with all these symptoms will suddenly come back. Will suddenly all come back. So this is the reason. That's why we want the patient, their body healing better. They have been eating, they've been drinking, they've been doing some like a good daily activity, and they are calm. Their body and their brain is not having any kind of activity. So that one, we can just tapping off this medication. All right. So the CNS depression, we don't want the brain just keep thinking about the alcohol. That's why we calm the brain. We depress the brain. So that means what? Aware, over sedation. Okay. And warning. All the use the caution when you have a history of a drug abuse, a liver disease, also respiratory issue. Okay, liver disease, I say that already. Over sedation will cause the respiratory distress, right? That's why they cannot breathe. So the drug abuse, okay. So this Librium usually we use it for the alcohol withdrawal symptom. So with a drug abuse like a street drug like a heroin or like a cocaine and a ketamine, something like this, usually is not controlled very well. Is not controlled very well. So that means what? Instead of you want using the medication to control some other substance abuse, it's not working. Why you want to use that? Right? Why you want to oversedate the patient like this, right? So that's why this is kind of contraindication. So we don't use the Librium usually to treat the substance abuse unless the doctor they have a special idea. All right? The phase of a recovery. So alcohol withdrawal patient, they need to have some kind of phase for the recovering. Okay, for sure. We go to the 2 stage, the detox and also rehab. So remove with all this kind of poison and the substance in the patient's body. We say it's a detox. So usually this is happen in a hospital. This is in the hospital. And the rehab, it go to like a long-term facility. Okay, when the patient just out of alcohol level and we feel like, okay, they are stable, that's why we'll transfer them to the rehab. So that's why you go to like the fancy rehab, like a Malibu rehab, okay? So that's why in that stage is not because of acute anymore. After acute is kind of recovering. So patient will stay there. Why the patient that recovered we still want to send into the rehab? Why? Do you feel like you trust the patient just discharge the hospital and they don't go back immediately to drink? We don't, right? We trust them, right? So this is the reason when they go to the rehab, maybe they still have malnutrition, they're not eating and drinking very well. And the patients still have some kind of like activity. Maybe have like inside they have the isolation or like a psychosocial problem, and they may still need people help. So that's why we send into the rehab. All the social workers and doctors and nurses and everybody will helping them going back to the normal activity, normal life, maybe get a job. So the rehab is taking care of this kind of very big important thing is that I want the patient is capable, is okay going back to their life. If not, I just send them back to their house, they'll keep drinking again. So we cannot take in the patient in the hospital always like this. We can. So this is the reason in the rehab we actually also monitor the patient and also educate the patient and also helping the patient they can progress going back on their foot. All right. So the treatment. So for some kind of like alcohol treatment is very special. Okay, we like to use the group therapies. Okay, so one of the very famous group therapies is called AA, the Alcoholic Anonymous group therapies. Okay, so you probably see the TV show or like a movie. You will see a whole bunch of people that making like a circle that sit together and they will start talking, right? So you're gonna have like a one therapist and it's gonna asking each of the people the question, how do you feel today, right? So from the beginning, they're gonna introduce themselves, say, hi, my name is Mark, and everybody will say, hi, Mark, right? So remember this, okay? This is anonymous. So most of the people that go to the AA group, they don't use their real name. They don't use their real name. Why they don't use their real name?
Is it just to feel like a sense of security?
It could be
Because they're
yes,
being vulnerable.
yes. They're also kind of like a confidential, right? Hip hop, right? And also there are several very important reasons. The reason number one, the people they've been drinking, okay, so they go to the group, okay, they could be find another drinking buddy, right? Yeah, so they will know their real name and their real address and real phone number. They will go to their house and they will drink again. They're having a party again. So you come to the AA group, just want to quit drinking, and then you find another people is kind of exactly the same habit with you. Don't you get excited? Yeah. And also, most of the people they have been drinking, they have some kind of big problem with their life. Okay. So maybe they lose the job, they just don't have money. So that's why they will come to another person's house and maybe asking for the money or asking, or maybe just kind of danger. And they will be robbing some people or breaking somebody's house. Remember, these people, they're drinking alcohol, usually they're kind of like a anti-social personality. They are not being adopted by the society. So that's why they are being struggled. So this is the reason that's why we've been telling them, okay, do not use your real name. Okay, do not use your real name. So either way, you are using some kind of like a special code to call your name, that's fine. So that's why in the AA group, you can call yourself, I'm an apple, I'm a banana. Yeah, I'm lemon. That's okay. That's okay. Yeah, it just some kind of like a code for you. That's why you go later to get help. Okay? It's extra knowledge. All right. Then we finish the alcohol. Now we need to move to the drug. Okay, the drug abuse. Okay, the NKS pay attention asking you some kind of like a drug abuse or like a drug overdose or addictive problem. Focus on the two category. The first category is the patient care. How can you taking care of the patient have this kind of problem? And the second category is for the healthy care staff, like a doctor and nurses and all the technicians. You working in like a hospital or facility, you're gonna have a drug abuse problem. Why? Because it happened too many times and also every year. So when the people working in the healthy care in this kind of field, they can steal this kind of control medication very easy. Remember, you need a doctor prescription, right? And all this medication is locked. So most of the technicians and also nurses, we have a key. So that's why we can open it. We can steal patient their medication. So this is the reason why I've been telling you so many times. Okay, stealing is not a good thing. It's for sure it's illegal. So that's why nurses cannot do this, especially stealing the medication. Okay, so now all the nursing board escalate with all the drug stealing is kind of in the high level right now. So please don't tell me, okay, I'm not stealing the patient control medication. I just took the patient the blood pressure medication. No, that's still stealing the medication. There's no excuses at all. So that's why be careful, okay? Uncle is gonna asking you one of the very important question is, and so can you stealing the control medication? Can you just use the control medication? Can you, as a nurse, can you have some kind of like a drug abuse problem? No, the answer is always no. You can. You can. All the 50 state nursing board, exactly, they have the same policy. If you work in a healthy care, you are not allowed to have any drug abuse. So you may not lose your license yet, but they will force you to get a treatment, and you need to provide the treatment, the detail until the nursing board. You've been just going to the treatment and by the psychiatrist doctor, and also go to the AA group or go to some kind of like a special group, and your drug or alcohol abuse problem is totally gone because they want you to know something. Okay, you need to know your cognitive, your mental very well. That's why you can use your brain to treat the patient. That's why you cannot every day just being confused or like disorientation and just treat the patient with all the drug. So remember this, okay? NCAS as a big two category for the drug abuse. One is for the patient. Do you know how to take care of the patient? Another one is for all the people working in the medical field. Okay, how can you deal with people that have a drug abuse problem, and including you? All right. So the drug abuse, we have some kind of illegal drug. Usually it's kind of like a street drug, like a heroin or cocaine. Okay, the prescription drug, like over the counter. So for example, over the counter drug, we talk about some kind of like a Cetaphil, right? So for the running nose, right? Remember I told you this is a control medication. We need to count it, right? And also lock it, right? So this is one of the medication that abuse from the over counter medication. Okay, and a depression medication, and also will cause the drug abuse, right? An opiate medication stimulate, and also will cause the hallucination genes, something like, for example, like a ketamine. Okay, cannabis. So this is a marijuana, and also some inhaler. Okay, all right. Let's begin with drug abuse. Okay, illegal drug, blah blah blah, like this. Okay, you can read by yourself. Okay, so some patient will going to tell you something like something. Okay, so if this work for me, it will work for my friend, or the one pill works two will work better. So when we use the over-the-counter medication, that's why some people are telling you, okay, I can share the medication. Remember, medication never just in the something can be shared. So that's why don't share the medication. Somebody share with you or you share with somebody. We need a doctor have a prescription. Even sometimes it's exactly the same prescription. Okay, but that person's medication could be expired. You just don't know. You don't know how that medication just staying on the counter so long, right? So this is the reason. That's why we don't use other patient's medication to treat another patient. We don't do that, okay? So that's why be careful of this, okay? You could be lose the license for this if you just get another patient's medication and to another patient. So some medication could be shared together. For example, like insulin. Okay, so then you will see some facility that's still very poor, not very good budget. So one insulin vial will be drawing all the insulin given to all the patient. That's still okay. That's still okay because it's not considered cross-contaminate. Okay, because the needle is not just we keep rotate the needle, right? But most likely you can see most of facility right now they don't want to get in trouble because all the survey and the state from the also federal they come over to check it. They will tell you, okay, that's not a very good idea sharing the medication. That's why most of facility right now they will use the insulin pen. Insulin pen. So that's why every patient they have their own insulin pen. It's very easy for the storage. It's not taking the big space, but each of insulin pen you can just inject the patient very easy and also better storage. All right. Okay, drug abuse. So the stimulant and the hallucination, and that's why you can read it by yourself. I don't think this part is very difficult, and you just need to know, okay, what is a stimulant, like a cocaine, like amphetamine, and nicotine, like a smoking, right, and a caffeine, okay. So like also hallucination type is like a LSD, like ketamine, and the magic mushroom. Does anybody know what's a magic mushroom? Usually we don't see it, but we do have this in the black market, magic mushroom. It's some kind of mushroom. Okay, so it's real mushroom. When you eat it, will cause the hallucination. Yeah, that's what we say the magic of mushroom. Okay, remember this is also illegal, but lots of people they don't know. Okay, so be careful of this. Okay, magic mushroom. All right, let's talk about the marijuana. Because marijuana become some kind of like a category in the NCLEX question right now. So marijuana we can use it to treat some kind of like anxiety, also panic attack. Okay, like some emotional inability. But it's by either way we can treat it, and either way will cause it. Okay, remember what I say again. So the marijuana either way can treat anxiety and also panic attack, but also will cause more panic attack and also anxiety. It goes by the both way. Okay, so this is the reason this is kind of like very annoying. Okay, so from the beginning you just want to provide some kind of treatment, but after that all this kind of anxiety and panic attack is coming back. All right. Increase the appetite, dilated pupil, okay, and dry mouth, okay, and dry eye, and also drowsiness, okay. So you either way, some the cannibal who can have like a smoking, a smoke like a cigarette, and also have some kind of like a gummy bear, and also have a peel, and also with a chocolate, and also what? So many different kind of fun right now. Okay, I saw people was eating chocolate is marijuana inside. Okay, so that's what I'm telling you. Okay, so for the cannabis, for this originally, so now in the California it's legalized, so that's why the doctor can have a prescription, the patient can use some kind of cannabis, so that they can have some kind of cannabis to treat maybe they have severe pain like arthritis, like a rheumatoid arthritis. It's very painful, right? And also for some cancer patient, so we do have a lot of cancer patients also use the marijuana. Okay, and so some people they have like a severe anxiety disorder. Okay, they all need a doctor prescription. They all need a doctor prescription. So if you carry the marijuana, can you carry a marijuana go to the airport?
No.
The answer is no. Okay, so marijuana, even you say is legalized using in that state, but marijuana is not allowed to transfer to another state. Remember this very important what I told you. Okay, in the future you may have some patient will argue with you, will say something not making any sense. They want to challenge you with your nursing knowledge. Okay, that's why remember to say that yes I know. So the patient is gonna tell you so. Okay, I have a marijuana in Las Vegas in Nevada state, but when I go to the airport they don't allow me to bring it to the California. But California is legalized. I don't understand why it's not legal. No, because control medication, each of control medication is not allowed transfer to another state. So that means what? If you get a pain medication in California, okay, so you want to bring the pain medication to another state and they just cut it. Can they take it away? Yes, they can take it away because by the state law, you are not allowed to transfer to there. But you're going to tell me, okay, so how about if I really need this medication? First, you need a doctor prescription. And also, each of state have a limitation how much you can carry on. So, for example, California is more strict. So we're going to tell you, okay, your pain medication, opiate medication, usually is kind of like 3 days. Like 3 days. So over 3 days, you still need a pain medication. I'm sorry, you need to get a provider in California. That's why get the opiate medication again in California. So that's why we don't care because we want to control the drug. Because if you don't control and people can bring the drug everywhere, right? Everywhere it has become like a chaos. So that's why also marijuana. So that's why your knowledge is going to tell the patient say because this control medication is not allowed to transfer to another state. So this is the reason. I'm sorry. So if you do have this kind of like marijuana in your house, you're not allowed to bring to another state if you're going to traveling. Okay, that will be very important knowledge. All right. So inhaler, you can just read by yourself. Okay. So some strong medication they put in like an inhaler, the type. Okay. So this is another two famous famous movie you can just watch it on the Netflix. They both talking about the pain medication, opioid medication is oxycodone. Okay, but they all both are based on the real story. It's happened. Is real. It's real. That's why it becomes some kind of like the TV show. So they based on exactly the same story, but they have a two version of the TV show. But the better one is a Painkiller. Painkiller, this TV show is much more attached to the real life. They even talk about how this company go bankruptcy because it's not having like a very good research and also cause a lot of people die in the Painkiller. So Pen Hustler is kind of more like just talk about the situation in that time. Okay, what happened? So I suggest you watch the Painkiller. You can know in that timing. So how is the people that abused by the oxycodone and lots of people that die for that. So this is the reason why we need to be very careful for that. All right. This is talk about the nurse right now. Remember, we have a two category. One is for the patient, and another one is for all the healthy care worker. So in the NCLEX, of course, they're asking the nurse a lot. Okay, they ask the nurse a lot. So can you use the drug? So this 7th state is kind of like a progress and offer the chemical impaired nurse opportunity of treatment and rehab to keep their license. That means what? Including California is also one of the states. If unfortunately you have some drug abuse problem, okay, the first time it doesn't matter you're intentional or not. You just use it, you got caught. So the state board will offer you the chance. Okay, we need you go to the rehab and see a psychiatrist and get all the treatment done, and then see all the evidence. You finish everything, you're all clean, and we draw your blood, we testing your urine. So many times later, then you can go back to work. So they are not revoke your license. They just hold your license. They hold your license. You cannot practice until everything clear. You are not using the drug anymore. You are not drinking anymore. Okay, but it's not talking about after the second time they caught you. So be careful. Each of the state have a different policy. In California, we are more like pay more attention on like the human right. So that's why in California it could be have like a second time. But in other states, so strict. For example, like Florida. Yeah, Florida, I remember if a second time you got caught, so they don't give you your license back anymore. Okay, so be careful. Each of state is a little bit different. Also, like Texas is also very strict. I remember Texas is only one time. You'll be gone. If I'm right, I'm sorry, I don't really remember this. That was many years ago, the conference I went to. So that's why, anyway, just let you know something. Okay, be careful. Don't use this kind of drug. If you do have a problem, please go to see a doctor first, okay, and don't walk. Because when you call in your job, your manager, also your supervisor, for sure, 100%, they need to file a report. If they don't file a report, the nursing board will revoke their license too. They'll revoke their license too because it's impaired and it's danger for the health care assistant. All right, so just let you know this, okay? Okay, all of this you can see is kind of like a history. Okay, you can watch by yourself. All right. So the alcoholism, so impaired to the nurse. Okay, when you've been like drinking like some period of kind of temporary, it's kind of like being like like a sedated amnesia. Okay, so that's why this is the reason that's why you cannot function very well. You cannot function very well, and also your behavior, and also because you're drunk. Of course, you cannot walk. You cannot just doing the job very well. Slur speech. Okay, you even cannot talk very well. So like a social isolation and a mood swinging, and like even like alcohol smelling, something like this. All right, and also kind of like exactly like a drug. They both kind of like the same. Okay, but here is the problem. NCLEX will ask you some kind of question. For example, you are working in the OR. You are OR nurse. So when you're on duty, you constantly smelling the surgeon have some alcohol smelling from his breath. And then you find out the surgeon when he just holding something equipment and the hand has some kind of tremor. So what's your nursing intervention? What should you do?
Report him?
Yes, for sure you need to report. Okay, can we stop the surgery? This is usually happen before the surgery. You smell already. So that's why the NCLEX give the scenario is not during the surgery. This is kind of like happen before the surgery, and then you find out, okay, you smell your coworker, the alcohol. Okay, for sure you report it, right? But can we stop the surgery? Can we call off the surgery?
No.
Oh. Yes.
The answer is yes. We have to call off the surgery. Because if you're one of the team member is danger to the patient, okay, so that means what? The whole team member need to be switched. That means what? All the whole team member need to be under some kind of investigation. Okay, patient come with a disease, we understand. I'm so sorry, so we have to call off the surgery. It's really our problem. Okay, we're gonna find out another team for you for sure. But this team need to under the investigate because one person if they use a drug or alcohol, that means what? So other people also need to be investigated because it's not because other people also drinking, but we need to ask other people. Say, do you notice maybe like the doctor, some doctors here have some behavior been drinking for how long? They need to know this. You know why? Because this person need to be like immediately terminate for this job. They cannot work. They cannot work until all the investigation clear. So that means what? If you're working with this person, you're also under investigation. You need helping with your hospital do the investigation. Even you didn't drink or something, but you need to cooperate with the investigation. This is something very important, like a jury duty, okay? Like a jury duty. So you need to go there. It's kind of like a, how you say, it's kind of necessary job. You have to do it. Okay, it's a necessary job. You have to do it. So this is the reason. That's why we have to call off the surgery. So that's why the surgery will be start immediately, and that's why if we have a second team, that will be switched to the second team. So the whole team, original team, they're not gonna perform the surgery anymore. So remember this, okay? As a nurse, is always in the final report. You have to report to your supervisor and to your RN, to your house supervisor or your manager right away. Okay, say okay, this person have like a drug addiction or over abuse problem right now. I need you to investigate. Also remember this, okay? If you did not file a report, that means what? Everybody know if this person is using a drug, all the license will get revoked. It's not exception, okay? Everybody in this team, everybody's potential damage patient's life is not acceptable, not forgettable. So the nursing board will revoke everybody's license immediately. Oh, maybe it's not revoked. We'll hold it. You cannot practice until the investigation is clear. So this is going to be such a pain in the ass. You need to protect your license. I'm sorry. You need to report this person. All right. So the substance used often because by the workplace stress and the fatigue and also burn out. So as a nurse, you happen this a lot, stressful and burn out a lot, right? Such an issue is kind of impair with job performance and like a threaten to the patient safety and lead like a severe career and also legal consequences. Okay, and high incident also going to be happen, right? Like we have like the number is kind of 14 to 20% registered nurse may issue with substance depends abuse or misuse. Is very high number. All right, most of common substance is kind of like alcohol and maybe also some kind of like opiate medication because you can steal from the hospital very easy. All right, prescription drug. Okay, due to easy access for all the nurses because we can open the drawer, we have a key. So that's why prescription opiate medication get missing very easy, like a fentanyl, oxycodone, and like a benzodiazepine. Okay. Special risk, okay, like a research team and misuse the rate amount of a nurse in the emergency, oncology, ICU, anesthesia, all this kind of department, we have a control medication, very easy, right? Right? So use it for high stress environment. Okay, now we have another NCLEX question I'm going to asking you. You find out one of your co-worker, okay, it doesn't matter with doctor or nurse or your supervisor, okay, constantly go into to touch with a control medication, the counting among control medication. And the constantly is still telling you, okay, his patient need a control medication. He always give a control medication to the patient every hour. Okay, what's your nursing intervention? Uncle has asked this before. Okay, so your co-worker constantly give the patient pain medication, for example, like morphine. Okay, every hour or every 2 hours. And he been telling you, okay, my patient just need a pain medication so often. So that's why I need to keep giving the pain medication. What's your nursing intervention?
Can you ask the patient if they received that medication or not?
But that's not
Can
your
you check the
patient.
order?
That's not your patient. So it's a HIPAA violation. You cannot ask his patient. Okay, wow, my God, that's difficult. What should I do? So you're thinking about maybe he's stealing the drug, right? How come the patient need like a pain medication every hour, every 2 hours, right? Something wrong, right? Do we have a patient like this? Yes. Patient maybe after the surgery, or patient maybe is an oncology, like a cancer patient, they need a pain medication so bad. Yeah, maybe every hour or maybe every 2 hours. Even you give it every hour, maybe the pain medication is still not working, right? Because of the tolerance, right? Patient use the pain medication so long, they have like a tolerance already, right? That's reasonable. And then he been telling you, okay, my patient just need a pain medication every hour or every 2 hours. So that's why your question is that, if your patient need a pain medication so often, did you tell the doctor for that? Why don't you tell the doctor, maybe you need to switch to another pain management, right? Maybe the PCA pump. That's why you don't need to do the IV push. Because the PCA pump is locked. You cannot steal the medication, right? It's a machine, it's locked. So you constantly need to get touch with this control medication so often. It's almost like every hour, every 2 hours, so often. Oh my God. It's a very high frequency. Medication maybe will be missing, right? So that's why you find out maybe his patient is sleeping, he still want to give a pain medication. Why you want to give a pain medication when the patient is sleeping very well? That's very suspicious, right? So the correct answer in NCLEX is you need to file a report to tell your manager or tell your charge nurse. So hey, you know what? I saw Mark. Is giving a pain medication every hour to his patient. Is that patient really need us so much pain medication? Do you feel there's something wrong? Is he over sedation, overdose the patient? It could be overdose, right? We have that consideration, right? So that's why your supervisor need to file investigation and say, okay, let me check. Let me see what's going on. They'll open the computer, will open the chart to see if he did give the medication, did he scan or not. And then we'll go to check a patient. We'll wake up the patient, asking the patient, did you get the last time pain medication? What is the last time? And what is the last time? How many pain medication, how many times you get already? And then you're gonna find out, okay, did he really give the pain medication, yes or no? Okay, remember this, okay? The NCLEX asks this question, lots of people answer it wrong. So if when you see your coworker constantly give a pain medication too often without assess the patient, okay? So that means what? This is very suspicious. You need to file a report. Okay, maybe he just give like a 2 times pain medication to the patient only. Another time he steal it. He put it in his pocket. You just never know. All right, remember this. Okay, you're the nurse. You always can kind of like question something, right? Okay, the next one, the alcohol and the drug abuse. Okay, for sure, for the patient, the first thing is patient safety. Okay, because you're the nurse and you use this. For the patient, you cannot have a very good, you cannot be alert and aware to give the right medication and the right patient. So that's why it's not safe for the patient. So this is the reason, that's why you need to file a report. And the consequence, that means what? The fine or the jail, okay? So that's why the legal action you're going to face on for sure. And the due to a duty of a report. So that means what? When you come over to work, you are not supposed to have any kind of impair of your knowledge. So that means what? If you know you are working today, you are not going to drink. Okay, so this is what happened to me many times. So sometimes I'm working 7 o'clock, right? So sometimes the hospital or the supervisor call me like 5 or 6 o'clock, asking me if I can just work extra day. It happened a lot, right? But sometimes I refuse. I remember a couple of times I refused because I tell them, say, you know what? I'm in the restaurant with my friend already. I'm drinking right now. I cannot work. I can't work. I'm drinking right now. So it takes me about at least like a 2 or 3 hour detoxing the alcohol from my blood. So that means what? When I go to work for this 2 or 3 hours, so my conscience is not fully 100%. It's not. That's not safe for the patient at all. It's not. So this is the reason. That's why you need to refuse the duty. So this is very reasonable. That's why I can tell your supervisor say I cannot work because I'm taking some special medication and I feel drowsy right now. Or either way, I'm drinking. I'm so sorry. All right. Supported program. That means what? So many states we do have this program. We can helping the nurse. Remember 37 states, right? Helping the nurse release this kind of stress and also like a substance abuse. And also remember, you also need to speak up. Okay, you need to speak up. If you're under lots of pressure, something like that, you need to let your supervisor know, okay, I'm under lots of stress. Okay, so that's why you need to give me some kind of break. I need to take a break. So in the California, it's pretty good because California, we are paying a very good attention of labor law and we have lots of union. Okay, so that's why they're going to help you out. But unfortunately, it's not union for the LVN. So that's why if you're LVN, it's a little bit difficult. So this is the reason that's why in LVN level, and that's why you need to learn a lot how to protect yourself. We do have a CNA union. Okay, even a CNA can have a union can protect them, but not just for the LVN. That's why it's very awkward. All right. So consequence and also written statement. Okay, you can read this by yourself. That means what? Investigation and discrepancy. How can I say this? Anyway, it's just a penalty. Okay, it's a penalty. That means you're gonna get a fine, or either way revoke the license and you go into jail. All right. Mental health disorder, okay. So when the nurses are using some kind of drug, sometimes it's not because they want to, it's because of maybe the stress or maybe they're depressed, okay. And maybe also PTSD. So for example, so I saw I saw some kind of new nurses working in emergency. When I was working in emergency, they got shocked. They never expect a patient will die in the emergency so easy. And they never see emergency is so kind of high impact. And they never know the emergency, the patient is kind of like a broken arm, broken leg. It's all the blood everywhere. Patient yelling and screaming every day. So that's why they get shocked. That's why they have a PTSD problem. And so how can they resolve? They still want to keep this job, right? They don't want to get fired. They still need to keep this job to pay for their student loan. That's why they do have some kind of drinking problem. They have some drinking, they go home and they drink. It's kind of like numb their body, not thinking about this. That's why they will go to sleep, force them to sleep. Because they don't want to go to sleep to think about this, have a nightmare. So this is the reason, that's why. So in the California, we also have lots of organizations helping for the medical staff. And your hospital, you should have this kind of like a help. Okay, the mental consulting. All right. So this is two very famous TV shows. So you probably just saw it, okay? Nurse Jackie and also the Dr. House, okay? So for both of them, there's kind of like a TV show is a character, but for both of them, the Nurse Jackie and also Dr. House, they both have an addictive problem. Okay, the Nurse Jackie in some kind of episode, she even stealing the narcotic medication for herself. She can take it because under lots of stress. And the Dr. House, from the beginning, he always admit, okay, he has an opioid crisis. He taking lots of opiate for his pain. That's why he have kind of addicted already. So that's why you're gonna see in the healthy care, we do have some people that use a drug or they're drinking a lot. It's not surprise. But unfortunately, we cannot allow this. That's why, from the beginning, we don't want to punish these people. That's why we'll send them to the psychiatrist or send them to the consulting. So this is the reason. That's why California is still pretty good. Okay, we would like to help you. So please go to see a doctor, get the treatment done. If you are clear, you still can come back to work. We will hold your license, but not revoke your license from the beginning. But please don't make this mistake again, okay? So you can see this TV show if you have time. All right. The question number 1. Okay, so the nurses is planning to start education program on the substance use in older adults. Which of the following is appropriate for the nurses, including the presentation? What happened to the older people, the senior people? They said the senior people require high doses of a substance to achieve a desired effect. No. They don't need higher doses. They still need the same doses, even the lower doses. Why the lower doses is better for the senior people? Why? Our idea right now for the senior adult, we don't like polypharmacy. In all the nursing school and medical school, now we are talking about polypharmacy right now. Why now we don't like this idea anymore? What happened to this senior people? Remember the first class I talked to you about like a medication? their liver and the kidney function is not acting like before. Okay, it's decreasing. It's not like a young people. So that means what? The medication stay in their bloodstream is longer. So if you're taking the high doses, it's going to cause like over-sedated or over like toxicity. So this is the reason that's why we use a little bit lower dose, and especially with a little bit higher dose, or either way, like the same dose will cause them to have like a confusion. So this is the reason that's why we don't like it. Okay, the second one, the older adult commonly use like a rational reason and to cope with a substance use disorder. That means that they tell you, okay, so I just use some kind of like a defense mechanism and to tell you what's the reason I want to use this medication. Oh, because I have very stressful life and I don't like my boss. That's why I need to take an Ativan every day. Oh, because I do have a financial pain. I don't have money and my boss is not giving me the raise. So that's why I need to use I need to over abuse like opium medication. So this is kind of like excuses. It's not real. Okay, that's why don't use it some kind of rational. The older adult is a high risk of a substance use following retirement. This is the correct answer. Why? When they retire, they have a higher chance have a substance abuse. Okay, most likely is alcohol. They drink a lot. And they will become like intoxicated because the liver function is not so good like before, like when they are young. Okay, but why after the retirement? Why not, when they get older, they don't have a job? Why that becomes such a big thing, and they become like depressed, and all they were easy to drink?
That they're bored.
They have nothing to do.
And that could be right because they got nothing to do, right? Most likely because they lost of the goal of their life. So remember, walking is such a big goal for your life. Why you wanna be in nursing school right now? Because your goal is to become a nurse. It's a job, not become like a goal, right? It's very strong motivation because you want to make a good money. That's why you want to be the nurse, right? For these people, what's the reason they want to survive? Because they need to work, right? They don't want to get the money, right? Suddenly they retire. They have this goal. They lost their goal. They say, I don't know what to do. I'm bored. For example, I'm boring. That's why I drink. And also another second thing is that lots of jobs actually can achieve with your confidence. So when you do this job doing good, that's why you feel like, you know what, I have very good use for this society. You feel satisfied. So suddenly you don't have this job, you don't have this title. So when everybody, remember in the society, we're always like this. Okay, when you go out, people like to ask you, so, hey, how are you? What do you do? Yeah, what kind of job you're doing right now, right? People like to ask this, right? But don't you understand when the people ask you, okay, what do you do? They are kind of evaluate your value of this society, right? If you're a doctor, you're a lawyer, they will say, oh, wow, nice, okay. At least you have a job, you're a housekeeper, they say, oh, that's good, and you're still working. But when you tell the people, no, I'm not working, usually the conversation is finished already because they don't know how can they just carry the conversation with somebody that have no job. Basically, they're thinking about you are kind of like a homeless. Okay, you have no job. What's going on with you? Honey, why you don't have a job? Yeah. Why don't you do at least do some volunteer, right? So this is the reason. That's why they feel like, okay, they've been left over, be isolated from the society. That's why they feel depressed. That's why they're drinking. All right. Older adults develop a substance use and to mark sign of dementia. No, it's not. It doesn't matter they are dementia or not. If people want to drink, they still drink. Okay. All right. Question number 2. A nurse is assessing a client who has an alcohol use disorder is experiencing withdrawal. Okay, this is for the patient who withdrawal. Which of the following is expecting finding? That means that withdrawal, sign and symptom. Select all apply. So when the withdrawal symptom happen, do they go like tachycardia or bradycardia? When we have a withdrawal, when the patient just have a withdrawal, usually they're tremoring. Okay, they're shaking, they're tremoring. So usually in that time is a little more acute. So we'll go to the tachycardia and also hypertensive. The blood pressure also go high, and the heart rate also go high. So that's why most of vital signs is going to be high. Okay, and the breathing also tachypnea. The breathing could be also a little bit high. All right. Unless they're drinking too much, it causes heart failure. If it's become heart failure, it will become like a bradycardia. But it's not heart failure, usually it's tachycardia. So that's why A is wrong, it's not right. Find Tremors with both hands, yes. Withdraw, they're gonna have a tremor or shaky with all the whole body or all the extremity. Okay. Hypotensive, we just say that usually the blood pressure is going high, not low from the beginning. All right. Vomiting, yes. GI effect. Okay. So they could be have a nausea, vomiting. Okay, so that's why they feel like alcohol is that they are not drinking, they have no food, why they still want to feel like, okay, they still want to vomit. Yeah, because your stomach has no food so long and only the alcohol. Your stomach also craving the alcohol. They also want the alcohol. If they have alcohol, your stomach becomes like lazy, they don't want to walk. But now he need to wake up, he need to walk, and there's no food there, he can walk. So that's why you feel nausea and vomiting. Alright, and number E, restless. Yes, they could have agitation. So that's why restless. Okay, so the correct answer is B, D, E. All right. Question number 3. Okay, a nurse is praying to care the client is have experienced the benzodiazepine withdrawal. Oh my God! So it's taking the medication and the medication have a withdrawal problem. So what is the following is a priority nursing intervention? Okay. So
Seizure.
yeah, seizure. Okay. So if the patient have a benzodiazepine suddenly just stop the benzo. Okay, they are taking the benzo. They have a withdrawal symptom. So we use the benzo to stop the seizure, right? So that's why the seizure will come back. Seizure will come back so fast. Okay, so be careful of this. Okay, the correct answer is C. Yes. Okay, question 4. Okay, a nurse is finding her co-worker frequently missing when on duty. When her co-worker showed up and he was not fully alert with a slurred speech. So the nurse noticed her co-worker arm has a new needle stick. Okay, what will be the nurse action for this condition? Move your co-worker to a quiet
D.
area so he can rest. Just find him a bed and he can sleep in there.
D.
D.
Yeah, it's D. Okay. Report to your floor supervisor. Okay, because he's using the draw. Okay, and monitor your coworker for the safety because your coworker suddenly become patient right now. So that's why you need to take care of the patient, right? It become your job. That's why you need to put your coworker in some kind of safety environment. Okay, maybe find him in a room and let him sit down or let him lie down and just tell your coworker, okay, just resting. Okay, I'm gonna call for the help. Okay, but actually you report, and your house supervisor come over here. So usually in this kind of situation, we will send your coworker to the emergency room. Okay, why emergency room? Just let him sleep. Why? Why you need to go to the emergency room? Okay, you are learning so many things with me. Okay, that's why you are learning how to protect your license. Okay. Any guess? Okay, let me tell you the answer. Okay. The first thing is we don't know how long is it people using the drug or alcohol. So it could be addicted already, and we need to find out the evidence. So when this person wake up and you accuse this person, okay, you've been drinking, that's why you're not fully alert. So that's why you cannot work. He's gonna have a defense mechanism. No, I wasn't drunk. I was just tired. You have no proof can prove I was drinking. You have no proof can prove I was injecting morphine. You have no proof. So they're gonna argue with that. So sending to the emergency, they can collect the lab, the blood and urine, right, and everything. They can collect it. They're gonna show the alcohol or the drug in their blood or in their urine. So we have evidence. That's why we can tell them and say, I'm so sorry. So it's showing your blood and your urine. So you've been using the drug. You've been drinking. I'm so sorry. So this is the evidence. And that's why you cannot argue. We need you clean. Okay, if you are not clear and you cannot come back to work. So this is the first thing you are going to tell him. Okay, this is the evidence. That's why we need to send you to the emergency. You cannot say no. If you say no, you're off duty today. You're not going to work today. Okay, because then you're fully alert. The second thing is the liability. Okay, so if you do have a patient, okay, or visitor, or anybody injury in your hospital, Okay, be careful what I say. Okay, if you find out some people had a further injury in your facility, in your hospital, and you are the primary nurse, okay, you need to call 911 for them. You have to call 911 for them. They may have a right to refuse the 911, but they cannot refuse you to call the 911 because it's your license. Okay, even your supervisor say don't call. No, don't care about your supervisor. You must call 911. You know why? Because whenever anything happens, if this person, how about this person have like a damage or they just die, even if it's your co-worker, but you know, you're the first one or you're the person know this person was kind of like intoxicated. So it means what is using the overdose of drug. And this person unfortunately just died or just injured, just fall in your hospital, or the visitor just happened something wrong. You did not call 911. Let me tell you, your license will be gone immediately. Because it's a violation of your scope of practice. Because you are the nurse, you are healthy care, working in healthy care. So whenever, no matter what anything happen, if you cannot handle for this patient's safety and the medical condition, you need to call 911. Let another person take over. Or the judge is going to asking you, the reason you don't call 911, is that because you can handle it? You can treat this person? Can you give a diagnosis? So that means what? Your answer is always no. Because you cannot get diagnosis, right? You're only the nurse. And can you treat these people? You have no lab. You have no anything. You have no X-ray. You have nothing. How can you know what happened to this person? Can you treat? Of course not. So the reason that you call 911 is you're going to save your license. You'll protect your license. Sending to the 911 is get rid of your responsibility. Even your supervisor, even the patient say no. I'm sorry, I still need to call 911. You refuse for the 911, not refuse for me. Okay, if you refuse to the 911, you don't want to go, I will just document. I will just document on my chart, on my note. Okay, so also another problem is, so when these people just get the damage in the job, okay, in the job. For example, if he been drinking and then he fall, have a brain injury, do you think he can claim the work-related workers' comp, the work injury, disabled? The answer is yes. The answer is yes. Okay, so the person get injury in the working environment. So that means what? Your job need to take 100% fully responsibility for this person's injury. They need to pay for him forever, or just pay for his disability. There's huge money. There's very huge money. Okay, so this is the reason. That's why your supervisor need to be smart. You need to know. Okay, I need to send this person away. In case if this person get damaged in my hospital, in my facility, we need to pay him a huge settlement. So that's why I cannot do this. At least I won't get rid of this responsibility. Okay. So remember this. Why I tell you this is because one day you're gonna become RN. If you become RN, sometimes maybe you don't have a supervisor. You are the supervisor. So that means be careful. You need to handle with it. That's why you need to call 911. Okay. All right. So this is the last picture. All this picture is in the public. Okay, you can Google it. So all these people, they all stealing the drug. All the nurses, all these nurses. You see, if one day you stealing the drug or you stealing something, okay, you cannot hide it. Your picture is gonna be online. We all can see you. Everybody can see your face. Okay, so all these people, okay, they're all stealing. And also we have news, okay? The nurse accused of stealing the drug, okay? In the jail, it's gonna be on the local news, okay? And your picture is gonna show. You're not gonna hide yourself. So no matter what, when you going to any state, any city to work, they can find out your faces, especially we have AI right now. You're not gonna get hired. You're not gonna get hired. But you don't need to worry about hired because your license is gonna be gone. Okay, you can never coming back to the medical field anymore. Just let you know this. Okay, yeah, we can find you. We can see you online. So don't steal the drug. Okay, I'm your instructor. I'm begging you. Okay, I don't want to see your picture one day on the news. That's one of my students stealing the drug. So this is the reason now I need to teach you. Okay, if your patient have some kind of drug and some kind of medication, they don't want it anymore. Okay, they don't want it anymore. They leave it. Okay, so for example, I'm an instructor right now. I can show you some medication, right? If my hospital they don't want this medication, I need to sign the consent with the pharmacy. The pharmacy is okay to let me take this drug for the education purpose. So that'll be fine. That'll be fine. I cannot use it to take it by myself. I can. Okay, just for the education purpose, it's fine. But I need to sign the form, the release form. Okay, that's why I will protect my license. So for normal people, there's no reason you can take away patient's medication. The medication need to be destroyed by the pharmacy right away. Okay, so that's why remember this. When you go to a clinic rotation with your instructor, so that's why remember every time if we have like a wasting medication, what did you do? You crush it and put it in like the shelf container or recycle bin, right? Did you guys do that? Yes? No?
Yes.
Yes, right. Okay, good. That means they will teach you good. Teddy, Brian, and also Granddad, they will tell you good. Okay, at least you are not in the trouble. If not, please change it right now. Okay, please change it right now. I'm telling you, I'm begging you. So I don't want either one of you showing the picture in the jail, and one day I will see your pictures. Oh my God, that's one of my students. I will feel very, very bad if I didn't tell you this. That's why today I'm telling you, okay, please do not steal from the patient, especially the medication, okay? All the 50 states, they have zero tolerance stealing the medication. They have zero tolerance stealing the medication. That's why they will put you in the jail. Maybe not in the jail, maybe not. It depends on what kind of medication, but your license is going to be gone and your picture is going to be on the public. Okay? All right, so we finished today. I know you have a very tired day. You went to the clinic. So I'm still working on your ATI final exam. So possibly tonight I'm going to post some partial study guide. Okay, I hope that tomorrow I can finish with all the study guide. That's why you can have it for the Tuesday. If not, again, don't worry about it. Okay, Tuesday we have a whole class. We're gonna review everything. Okay.
And
Thank
answers
you.
too.
Yes, and can you wait
Don't
for
forget
me?
the answer.
Don't forget to study.
Don't forget the answers.
No. Okay, wait me a second. Okay, I need to call attendance. Okay, wait a second. All right, let me see the people here.
Rosary here.
Rosary,
Relax
okay.
here.
All right. Rosary and Sue and Melina and
Hi, I present.
Oscar. Here. Oh, Stephanie, okay. And Alice. Bryce.
Yeah, I'm here.
Okay, and Yuan Yuan, okay.
Yes.
And this one. Oh, Susie. And first row. And Yuri. Okay. Vanessa. And April. Joyce. Perla.
It's present.
Yes, good. And Kiana. And let me see the next one. Okay, is anybody I didn't call?
Alice?
Yes, I have your name.
How about me?
Who is me? Who's me?
Susie.
Susie, yes. I have Susie, your name. Yes.
Did you
Alright.
call me, Mr. Patrick?
Yes, I have your name. Stephanie, I have your name. Yes.
Okay.
All right. So,